And now we have Dr. Girish VELIS. He's our next speaker. He's an alumnus also like me from KEM Hospital, Bombay. Then he went on to do a retina fellowship from Arvind Eye Hospital and now currently a vitreoretinal surgeon in Goa.
Yeah.
Dr. Girish.
So, basic. Yeah. So basically, as a clinician, we are well equipped with examining the patients and diagnosing and treating their problems. But when it comes to explaining the conditions and telling about the treatment and all, sometimes there are many challenges which we face in day-to-day practice, despite a good treatment also. So a picture speaks more than 1,000 words is like this when pictures are circulated in the WhatsApp university, social media, and some of the conditions which are already explained to the patient previously, but because of sometimes a VIP or pseudo VIP syndrome, they are taken in a different manner in the media. So the reasons are many a times whenever we are explaining about the conditions, sometimes there is no clarity about the particular disease when we are explaining the patient. The lack of clear communication before the surgery or during the surgery, or sometimes the surgery can be slightly eventful. So it is important to have a clear communication. There might be a failure to diagnose a particular case also. Improper chair time explaining about a serious condition or a particular condition. During a busy OPD or in a high volume setup, sometimes some things can be missed and sometimes may not be properly addressed also. From the patient point of view, what happens, they are always going to compare either with their with the first operation for the second eye surgery, or from their own neighborhood, or from the relatives and all that. Sometimes they have some high expectations. Some of them are over demanding. Some of them expect for some guarantee and all. And sometimes some have that sort of pseudo VIP feeling. So such sort of patients are encountered in the, it's not just in the particular scenarios, but it can be in the general scenario in a cataract practice and extending till the refractive things also. Particularly speaking about retina, because I am a retina surgeon, so there are many conditions in retina which are like CSR, patients having floaters, dystrophy, and so many other things where proper counseling and proper explanation is very important for the proper adherence and compliance to the treatment. Some of the things may not be treatable, but it is important how we communicate and how we tell them that the condition is going to unfold in the near future, like that. So the solutions are like, yes, every patient, he has his own whims and fancies, and he is always he doesn't know about what is the problem and all. So he'll always be thinking that because he is able to see, why he should take the treatment and all. So sometimes it is important for us to identify a particular problem and identify a particular set of patients who are going to be certain subset of patients. So we need to explain them sometimes the urgency or sometimes the need to wait for a particular thing also. We need to give them a rough estimate about the cost, number of procedures, or sometimes a resurgery may also be required. Like in a retinal detachment surgery, we need to tell them beforehand only. If we are putting oil, we need to explain to them that there is a need for silicone oil removal also later on. Sometimes some conditions are treatable, but there are conditions which may not be treatable also, and that we need to tell them. But it's not that all the cases are like gone cases. So we need to give them a ray of hope, properly explaining the amount of visual recovery. So the communication can be a verbal by we can explain to them whenever they are with us, or sometimes through telephone counseling also. Sometimes how we are able to how we are telling the things through our body language and gesture also matters a lot. And we can give them a written informed materials or show some visualization charts which can help them in understanding the particular condition, and getting adherence to the treatment will be improved. So the basically it's like a contract between two individuals, and we are trying to explain to them so that they are able to understand the problem and they are able to take the treatment. So majority of the issues definitely needs to be explained to them so that they are able to understand the condition and able to go ahead with the treatment things. We need to be compassionate and patient to understand their problem also, and we need to listen properly. We cannot deny the fact that we need to properly take a consent and document all the things in the busy scenario also. So sometimes the counseling can be done by us also, or by the counselors hired who are properly trained in such conditions. There are advantages. Sometimes some patients expect that the doctor only should explain to them everything, right from the expectations about the surgery and till the end of the cost and all those things. Some of the patients but there is no end to the questions. Sometimes they might be asking certain questions again and again also. So sometimes the role of counselor also becomes important, that you can tell them that please, they will be explaining you rest of the details, and if you still any have doubts, I'll be able to clear the things. So it is important to explain to them regarding anatomical improvement and functional outcome. Like we can explain to them the 90% of the success may not be correlating with 100% improvement in your eye recovery, visual recovery also. So written materials for education can be given, and they can be made to understand about the particular condition, and appropriate examples which they will understand in their own language can be made. We need to properly explain to them for that much time that sometimes a retinal detachment surgery can take more time, or might require again resurgery also. At the end of the things, we need to ask them that if you have any doubts, and can clarify about certain things also. It's important that all of them are addressed at the same time. Otherwise, once we have finished explaining them everything, and then suddenly they will say, no, there are 2-3 people we are waiting outside, and they are the one who are going to take the decision. So it's important to explain the guarded prognosis properly. And at the same time, it is also important to tell them that if you don't get operated, what is going to happen later on, if means whether the condition is completely going to cause you blindness, or how much percentage things are going to happen. So it's important that we are explaining them in a less busy scenario, in a this thing, and with the number of people who are going to take the decisions. So at the same time, it is important that when not to operate also, regarding certain cases, we may not be having a particular experience about that particular case. The amount of risk we are able to take depending upon our expertise. Sometimes some of the cases we know that may not be doing good, and we want to take chance or something. So multiple systemic comorbidities also need to be taken into consideration, like that. So yes, there are many challenges where patients will be going for second opinion, or might be Googling, or might be taking help of other things and all. But at the same time, we need to consider all those factors and explain them about certain things. So yes, there are many times some of the patients might be already having taken some opinions at some other centers, and might be over exaggerating to us, and we need to identify such people and understand their proper behavior, and tackle accordingly and handle them accordingly, like that. So it's we cannot satisfy, I mean, everyone. Although you have explained all about their condition, although you have told them about everything, they might still be unsatisfied. A 6x6 person after a proper uneventful phaco surgery might still be cribbing about his itching and watering and all those things, which can be counseled pre-op also, or later on also, like that. So it's sometimes it may happen that you have to tell them that yes, such sort of condition you can consult another doctor. They will give you another opinion, like that. And so there are many things where you can't explain to them, but it is always important that we are trying to address their as much as questions possible, and take their things into proper consideration before you take up for surgery. So I would like to conclude the session by saying that mainly it's like we are doing our work, whatever possible, best possible from our side we should do. And ultimately the results may not be in our hands also. But if we have properly taken a consent and documented certain things, many of the mishaps can be prevented in the current scenario. Yeah, thank you very much.